how do you, in your clinical practice, meet, say women between 35 and 45 that are starting to step into perimenopause? They have body composition changes that feel negative. They have brain fog. Many of them are probably postpartum or have had children or are having children within that decade as well. And they just don't feel like themselves. And how are you using, hormones, peptides? How are you supporting cellular health? Because, that is an emerging topic
Right.
it's more trendy now than it used to be. It's supporting all these different anchors.
Definitely. I think it's important to start with a baseline
Mm-hmm.
and really important to focus on the patient's story and experience. And even in naturopathic school, we're taught as physicians to listen to the patient.
Mm-hmm.
But then what happens? You graduate and you're so fixated on what the labs show.
Mm-hmm.
So you're listening to the patient, but you're looking at the labs. So for perimenopausal women, one of the biggest issues is that their labs are normal.
Right.
Their FSH, their LH is in range, their estrogen, their progesterone looks fine,
Mm-hmm.
but they're not sleeping well, they're gaining weight, they're anxious, they're depressed, their libido is down the drain. So we have to look beyond the labs, and even a 24-hour urine test can be limiting. We really have to focus on what is that unique patient's presentation. And so, of course, the standard lab range versus the optimal lab
Right.
range. We know that optimal can also vary person to person. And I've had women who, let's say, have fertile levels of progesterone,
Mm-hmm.
but maybe they're still experiencing spotting or
Right.
irregular cycles,
Right.
or they're still anxious and can't sleep at night. So I will always take and trust what the patient says first and foremost,
Mm-hmm.
and then use labs as my guide. And when it comes to hormone replacement, we're just very careful in what we prescribe.
Mm-hmm.
I never prescribe synthetic hormones
Mm-hmm.
unless it's absolutely necessary. I use it as a bridge
Right.
until we can get symptoms stabilized, and until we can get someone to feel better. We're always leading with bioidentical hormones with the minimum effective dose.
Right.
There's just no reason why we need to start on a very high dose
Right.
when it comes to hormones. And there's a lot of education that happens around hormones because so many women have been burnt by the Women's Health Initiative.
Mm-hmm.
And I also read a lot through different menopause organizations. They're still mixing progestins with progesterone.
Yes, I've noticed that.
Estrogen, there's no differentiation between oral estrogen, transdermal,
Mm-hmm.
vaginal. Like when we're talking about research, when we're talking about hormone safety, we have to be so clear about what hormones, what routes, what dosing
Right.
that we're talking about. And so I start with a baseline, and that's usually looking at their current hormone state, their nutritious state. So like Vibrant has amazing testing
Mm-hmm.
that we can do, especially the nutrient profile and everything else. And looking at metabolic markers.
Mm-hmm.
Inflammation is huge. And what we see with hormonal change and metabolic changes is that insulin can go up and can stay up.
Yeah.
HSCRP can go up and stay up.
Mm-hmm.
And once we start improving, whether it's diet, lifestyle, nutrient deficiencies, as well as get the right hormone replacement on
Right.
board, because hormones regulate inflammatory pathways, we see their inflammatory markers improve. And as we correct different imbalances, I start to weave in peptides as needed. I'm not the one to just throw a bunch of peptides the first visit unless it is necessary.
Right.
And I see the need for it. I use them very carefully and an as needed basis to really optimize specific systems.
Do you want to explain what peptides are? So they're like amino acid sequences that are less than 100, right? Something.
I believe 18.
Okay. So they basically function within the body already. We make them. They're endogenous, but then they can decrease over time.
Yes, just like everything else, right? And I think we're used to hearing that hormones decline with age.
Yeah.
Everything else declines too.
Yeah.
So it's even our GLP-1 sensitivity and receptor health number, that declines too, which is why like GLP-1s become so important. But peptides are branches of amino acids.
Mm-hmm.
And depending on the amino acid formula,
Mm-hmm.
that dictates the sort of the peptide and the system that it can benefit. So for example, growth hormone peptides, they stimulate growth hormone release, they stimulate IGF-1 release, very important for bone health, muscle health, recovery, collagen production. This is a very important hormone that frequently gets missed and is not properly evaluated. We've got BPC-157 can actually upregulate growth hormone receptors, can make you more receptive to growth hormone, can also help with gut health, gut lining. So anything that requires repair and an uptick in growth hormone signaling, like BPC-157 is fabulous. And when it comes to inflammation, we've got the thymus gland, and that is the master regulator. And just like everything declines with age, stress, even different disease states.
And toxic exposures.
Right, absolutely, which impacts endocrine function. Thymosin peptides are incredible. They're they've done some research where people who are prone to autoimmune conditions have a lower amount of thymosin alpha 1 and thymosin beta 4 peptides. And they're very important in regulating the Treg cells so that we stay in balance and homeostasis. But those are just some of the examples of what peptides are and how they can be really system specific.
What are peptides that you use for brain health?
I love dihexa. It is an orally available peptide. It used to be by prescription only mostly. Now there are definitely some companies that have made it available to an average consumer patient. It is very important in protecting the serotonin and dopamine producing neurons, as well as neurogenesis and synaptogenesis. So we can improve the communication between neurons as well. And it can also preserve the hippocampus. So for a lot of women who are struggling with dementia or memory issues, and we know that most women, unlike men, are predisposed to Alzheimer's and dementia as we get older, sleep, estrogen decline, so important. For women, especially who are maybe not candidates for hormone replacement for whatever reason, or are scared to start hormone replacement, dihexa can be a really good peptide to consider because of just how neuroprotective it is.
Yeah.
And there's some other ones like Semax and Salang. Those are some of my favorite peptides as well. They're just not as readily available.
Yeah, I think there's some regulation changes that are always happening with peptides, but
yes. And I love those peptides. And unfortunately, they used to be so much more available.
Yeah.
They're not anymore, but dihexa, thankfully, is available. And it is one of my favorite peptides to include for all of our brain health. I would say when it comes to brain health, just peptides aside, I also like to consider ketones, the role of ketones, because that's just direct fuel. Our brain is a huge caloric consumer, glucose consumer, and ketones is that direct fuel. So anytime our brain function is compromised, ketones is that immediate fuel that can really help our brain function more optimally. I also love plasmalogens.
I love them too.
Right? And the fact that they're available in this day and age for us to supplement with, which on the topic of decline, yes, we need peptides because they just naturally decline with age, time, stress, endotoxins. Plasmalogens, technically we can get them through the omega fatty acids that we get from our diet. But again, it really depends on liver function, depends on metabolic health, estrogen signaling. So it's really important to have this more holistic approach to brain health. Peptides are amazing, but we got to look at diet. We got to look at how else can we support the overall mitochondrial function of the brain.